Hello everyone, welcome back to my channel and welcome to another episode of the Health Talk segment. In this segment, I'll be interviewing different people in my community to find out how much they know about diabetes mellitus. So let's go!
Yeah, I know some of that.
Sifo sashukela sifo lesibangela ukuthi umuntu anawo insulin yakhe ingasebenzi kahle bese ushukela lo kuba khona la emtimbeni uba mningi kakhulu kunaleyo kulokufanele ukuthi abe khona.
Sifo sashukela ngicabanga ukuthi ngesikhathi shukela amningi engadini kunashukela lo weqile engadini kunalo lodzingeka emtimbeni.
Diabetes, I don't know how exactly can I say it, but I know the symptoms.
Okay.
Yeah, I know the symptoms per se. How can I describe it? It would be a bit difficult. But I know someone who is diabetic, and the symptoms I can tell with this person is diabetic.
What are the symptoms you can see?
Like over thirsty too much. Yeah, wears a lot of water. We sweat. We are like body shape yake.
Like losing weight.
Yeah, lose weight too much. Yeah, he eats a lot. Like if you're diabetic, well, like every time you're going, you have to have a lunch box. Every now and then you have to eat. Every now and then you have to eat.
Obangaba naso.
Ngicabanga sifo singakhethi.
Omunye futhi angaba na shukela ngokuthi emndenini yakhe khona lo nawo.
Okay. Shothi nje nawe umfana emndenini wakhe nanginalo no sugar nayo sotoba nayo.
Hayi ngase sonke isikhathi. Labanye baba bethu abanye baba.
Okay, kuya ukuthi kuya ama-genes ukuthi unaweni lama-genes alomfana shukela. Angana nama-genes alomfana shukela.
Okay.
Yeah, they can have it.
Why?
Like you can be born diabetic. Like for instance, in your family, if there is a history of this disease, then definitely for sure one of these people who are coming before that person will have it.
Ubona ukuthi lo muntu afome kakhulu umtimba wakhe uhlala dziniwe akhale ngekudzini kube kude nala kwendini.
Mawutibuka wena nothi mawufuna ukubona lomunye mawutibuka wena especially laba abachama bangasenze ama-toilets like la lochama khona then mawungachama uhambe then mawuya emva isikhashana dokhanza nento entothwane lo usho kona ukuthi umchamo wakho shukela wakho umninga ngoba uzoweqele afike emchameni wakho noma mangabe unesilonzi mangabe isilonzana noma soye esibhedlela so asphol naloko ungasho ukuthi unashukela.
Umuntu onashukela uvamisile lokuthi chama angaqedzi chama kanyeni.
Niki lo uyagwema ukuthi nasetinto leti sweet kakhulu.
Manje ngiyacabanga ukuthi ungenda njani wena singabe kusayikhanuka le Coca-Cola kanemvala lona ishukela ekhaya.
Ngayithenga mina nginathe.
Lambi kwakhe
somewhere yena.
Somewhere.
Yeah.
We used to go to the hospital and follow the instructions that are going to give to him. And avoid some of those things that can make that disease become in your body.
So if let's say a child in your family is diabetic, what foods can you eat, and can you just eat cold like cakes in front of the child or cold drinks in front of the child?
No, actually you're not supposed to eat those stuff, so it will be advisable to you stay away from such.
So you yourself who is not diabetic?
Yeah, I mean I can, because I know the seriousness of this disease.
We all know someone that is diabetic, and diabetic is a very broad topic, but we are going to talk about it very briefly and in a very simplified way. So what is diabetes? Diabetes is when there is excess sugar in the blood or excess glucose in the blood. When we all eat food, our sugar levels go up, but there are hormones that are responsible for regulating our sugar levels in the blood, and mostly that is related to diabetes mellitus is insulin. So when we eat food and the sugar level is high, insulin is going to take away that excess sugar and store it, so later on it can be released to the blood again when we have low sugar levels. So in people that are diabetic, the insulin is not working properly. There is a problem with their insulin. So when this person eats a lot, when this person eats and the sugar levels are very high, there is a problem with the thing that is supposed to take the excess sugar and store it away. So there is excess sugar circulating in the blood of those people. So the most common types of diabetes mellitus, we have type 1 and type 2. So mostly in type 1 diabetes, this is when the insulin is not produced at all, or it's produced very little, because there is a problem with the organ that is producing the insulin, or the cells that are producing the insulin. So by the way, the insulin is produced in the pancreas. So if there's a problem in the pancreas or in the cells that are pancreas that are supposed to produce the insulin, there is no insulin that is going to be produced, and there is going to be a lot of sugar in the blood, and there is nothing that will take away the sugar and store it. So mostly it's an autoimmune condition whereby our own body fights against the cells in the insulin, and this will cause the cells to die, and in that event no insulin will be produced and no sugar is going to be taken away and stored, mostly seen in children. In type 2 diabetes, the problem is with us, which I may say the insulin is produced normally, we're born normally, grown up normally, but because of eating so many refined stuff, white sugar, so many sweet stuff, fatty stuff, soda, colas, all those things, we are giving the insulin a very difficult time. So the insulin gets tired of uptaking this excess sugar that is in our bodies and storing it away. So now it becomes resistant. It cannot uptake so much sugar and store it away. So in this case, the problem is with us. The insulin is produced normally, but now it's tired. It becomes resistant and it cannot take away the excess sugar that we have. So in this case now, how the people are normally treated with medications, because they have the insulin, unlike the type 1 diabetes. So this is the most common diabetes that we can see, but it's not everyone that is having unhealthy lifestyle, obese and not exercising, that is going to have type 2 diabetes. But genetic factors also play a role here. So if you know that someone is diabetic in your family, please be careful and try to live a healthy lifestyle, because very soon you are going to have the type 2 diabetes mellitus. And this type 2 diabetes mellitus is mostly common in old people, but nowadays we can see it also in young children, like 10-year-olds, because you find very obese young children. The parents are giving all those pizzas, KFC and the likes to the kids. So we can also see it also in young children as well. So we also have other types like gestational diabetes, which is seen in pregnant women. So the common signs that we normally see in diabetic patients, or if you yourself are starting to suspect if you're diabetic or not, you have excessive thirst, or you want to drink, excessive urination, excessive hunger, you want to eat a lot, you cannot be satisfied, you want to eat but you are not gaining any weight. And also since the sugar is so high in your body, even in your urine the sugar will be there. So as that person say that sometimes if you don't use the toilet and you decide to urinate outside, you may see those ants coming to eat. So those are like the most common signs that are seen. But there are also other signs that can be seen, like your wounds can take so much time to heal. There might be tingling sensations in your hands, in your feet, fatigue. Sometimes there may be weight loss, nausea, and headaches, but those symptoms are also seen in other conditions. Things we should look out for: these patients may have hypoglycemia, when like the sugar is like very, very low, or hyperglycemia, the sugar is very, very high in this condition. So these patients may show some symptoms, and these conditions are like kind of emergencies. We really have to help them fast and take them to the hospital. So let's start with hypoglycemia, when the sugar is like very low. Okay, the symptoms we are going to see: the person will be shaking, hungry, sweating, and starting to look confused, or now they're starting to lose consciousness, and sometimes they may even have seizures. Those signs show us that this person's sugar levels are extremely low. So in that situation, if you're at home, just go in your kitchen, take sugar and give to that person, or make juice or a sweet or any sweet thing that is in the house. So that thing is going to help that person to boost their sugar level to go up. But if the person is already unconscious, please make sure you try to take them to the hospital as soon as possible, so they can give sugar solutions intravenously, so they can be better in a very faster way. So sometimes the people can have hyperglycemia, which means the sugar levels are very high, and in this situation we are going to see the person drowsy, with excessive thirst, with like some kind of difficulty in breathing, and also they might have sweet smell coming out from their mouth. Like you can just smell something sweet coming out from their mouth. You can suspect that their sugar level is very high. Sometimes they might have blurred vision, nausea as well. So if you're at home or in a certain place, just give water and ask them if they took their medication. Sometimes they might have skipped their medication, so please, they should take their medication. Then you have to send them to the nearest hospital, because they have drugs that can help to decrease their sugar levels very fast. So these are the emergencies that we can see in people that are diabetic, or people that might be diabetic and they are not yet diagnosed. Please make sure you get diagnosed for diabetes if you are suspecting you are having it, if you are seeing those symptoms, and please make sure you control it if you are already diagnosed, by taking your medication. And if you are taking your insulin, please take it on time, and please use the right doses, because if you use excessive doses, that's going to be a problem, because you might end up hypoglycemic. And if you are taking your medication, your tablets, please don't miss it, because you might end up hyperglycemic as well. And sometimes the people with type 2 diabetes that are supposed to use only the medication end up sometimes using the insulin as well, because maybe they are not taking the drugs effectively and it's not working effectively. Then they end up using the insulin to help control the diabetes very normally. And also, we should also remember that in type 1 diabetes, these people are going to use insulin for the rest of their lives. So they're getting injections for the rest of their lives. So don't be shocked when you're seeing someone injecting themselves. They are not drug addicts. Some may be diabetic. There are very bad complications that can occur. It affects your blood vessels, and when your blood vessels are affected, you'll have stroke, you'll have heart attack. It affects your kidneys, it affects your eyes and your nerves as well. And sometimes there is poor wound healing. When wounds don't heal good or heal properly, when they're infected now, that limb has to be amputated, and amputation is very bad. So please make sure you get diagnosed, you control diabetes, and also prevent it. Mostly please prevent it, because type 2 diabetes is preventable. So thank you so much for watching. And as I've said, that the topic is very broad and we couldn't squeeze everything here. Please visit our Instagram page and Facebook page for more information.